Have you ever wondered what happens during a heart bypass surgery? Let's break down this life-saving procedure. It all starts with the problem, coronary artery disease. Look at this heart model. These vessels on the surface are the coronary arteries, and they supply the heart muscle with blood. Over time, plaque, a mix of fat and cholesterol, can build up inside them, narrowing the passage and restricting blood flow. This can lead to chest pain and even a heart attack. To fix this, surgeons perform a coronary artery bypass graft, or CABG. The surgery takes place in a highly sterile operating room. Before it begins, the patient is put under general anesthesia, meaning they'll be completely asleep and feel no pain. Vital signs like heart rate, blood pressure, and oxygen levels are constantly monitored to ensure safety throughout the procedure. The surgery begins with a careful incision through the breastbone, or sternum, to access the heart. Once the heart is visible, the patient is connected to a heart-lung machine. This incredible device takes over the function of the heart and lungs, circulating and oxygenating the blood so that the surgeon can work on a still, non-beating heart. The heart is then temporarily stopped using a special cold solution. Now for the main event, creating the bypass. The goal is to create a new path for blood to flow around the blockage. Surgeons can use a healthy artery from a chest wall, like the internal thoracic artery, and reroute it to a point on the coronary artery beyond the blockage. Another common method is to use a healthy vein, often taken from the patient's leg, called the saphenous vein. One end of this vein graft is attached to the aorta, the body's main artery, and the other end is sewn onto the coronary artery, past the narrowed section. This effectively bypasses the blockage, restoring blood flow to the heart muscle. Once the grafts are in place, the heart-lung machine is disconnected, and the heart is carefully restarted, often with a small electrical shock. It begins to beat on its own again, now with its restored blood supply. The surgeon then closes the breastbone, usually with strong wires, and stitches the skin incision. The patient is then moved to a recovery room for close monitoring as they wake up. While this surgery is a major undertaking, it can dramatically improve quality of life for many people. Remember, this information is for educational purposes. Always consult with your doctor for medical advice. Thanks for watching. Please subscribe AI Promo Tips for more video and comment your topics for next.